Varicose veins actually are normal veins. Usually, the veins are the ones that bring blood back to the heart. No? So these are normal veins that in time eventually enlarge, they engorge, and they get twisted. It's usually more associated sa lower extremities, sa legs and thighs, but actually it can occur anywhere, sa arms, sa abdomen, and those areas. Well, varicose veins, no, are common conditions, no. It can be because of hereditary. It can also be because of pregnancy. Sometimes also work-related. When we say work-related, those who have jobs that require prolonged standing, prolonged sitting, and sometimes these things develop in those subset of the population. Well, we have two methods of treatment. No, we have the conservative, and we also have the surgical part. No, when we say conservative, we usually just place an compression stockings, elastic stockings, and then we do the exercises like ankle pumping or walking or those conservative things. But the problem with the conservative management is that we don't correct it anatomically. So the problem is still there, but we just try to prevent its progression. Now, we go on to the surgical part, which is the most ideal. And the surgical part has many types of treatment. But in the context, no, and as a whole, the general idea is that we ligate the veins that are problematic, and it prevents the veins from giving the patients symptoms of heaviness, of swelling, of skin discoloration and discomforts. When we do vein stripping, practically the whole idea of stripping is that we strip the veins out of the legs, which is the most common site of the procedure. So we insert a probe into the vein, and then practically we just pull the vein out of the extremity. So that is named vein stripping. Well, aside from the usual medical risk, when we go on a procedure, the patient has to be checked for any problems in the heart, the lungs, and other system before they undergo the procedure, because vein stripping usually may need anesthesia, spinal anesthesia or sedation, and this entails some medical risks. So in the procedure per se, the most common problems that we encounter are bleeding, swelling of the extremities after the procedure, but the other uncommon problems that are usually encountered are nerve injury or nerve damage and those things. Yeah. Varicose veins in general does not give life-threatening problems or situations. However, most of the common complaints of patients are the leg swelling, the leg discoloration, and also sometimes leg pain, easy fatigability, and sometimes their ankles or their legs become very swollen that they have difficulty fitting their shoes or socks or pants. So those are some of the problems that probably are most disturbing to our patients. Well, if the individual experiences leg pains, swelling, discoloration, especially in the ankle area, and then sometimes to the extent na there are already non-healing wounds in the ankle area, this could be signs of chronic venous insufficiency. So sometimes also the veins are already visible, so that is cosmetically not appropriate or very embarrassing for the patient. So if they experience some of these signs and symptoms, probably it would be best to have it checked to a doctor, a vascular surgeon or a cardiologist would do. And then probably the next thing that diagnostic tool that is going to be recommended would be an ultrasound of the lower extremities. If it is not clear that it's varicose or chronic venous insufficiency. But if it is clearly visible, probably we may not need any other diagnostic procedure. So for prevention, if the cause of the varicose veins are hereditary, there's little thing that we can do about it kasi hereditary. Or kung pregnancy, it's also common in pregnancy. So these things we can really prevent them, We can prevent to some extent, pero sometimes we just come pa rin. Pero for work-related causes, the simple thing is if you're doing prolonged sitting or prolonged standing, so probably you need to take a break every 15 to 30 minutes and you just do ankle pumping exercises, your toes up and down, rest for a while, and siguro you can also use compression or elastic stockings to prevent stasis legs. So these are some of the conservative ways of treating or preventing varicosities from happening. Well, if you will be able to catch the signs and symptoms early, it would be best to have it checked to a surgeon, cardiologist, so that if it's still early, measures can be done to prevent it from progressing, or if it's really at the advanced stage, probably options for surgical management can be offered to the patient so that he or she does not have to deal with the signs and symptoms for prolonged periods of time.